FM. My name is Biblas Chidi, but before I go on to what I have for you this morning, I want to say hope you're doing well. Wherever you are, be it in the market or at your business place, your offices, at homes, I do hope you're doing well and having a swell time. All right, today I want us to go right straight into what we have this morning, and that is what you all know about. But before I go on, let me use an illustration. Have you ever tried to, or have you ever been in a bus and someone opens his mouth to yawn or to speak, and then a very strong odor oozes out from the person's mouth, and you're like, ooh, what is this? What is happening? And you cover your nose immediately. And if you're trying to be polite, you don't want to show that something bad is smelling. You try to take away your face from the person's face or close to you. You know, this is called bad breath or mouth odor, as we all know it to be, as we all call it, mouth odor. It is called bad breath, and in medical terms, it is called halitosis. So today we are going to talk about this problem because a lot of people are battling mouth odor. Some people are aware that they have mouth odor. Some people are unaware that they have bad breath. So I'll be using mouth odor or bad breath. So whenever you hear the two, just know that I'm talking about the same thing. So in a layman's term, it is mouth odor, but the name is bad breath. Okay, and in medical terms, it is called halitosis. So we'll be talking about this thing today. So if you know someone who has bad breath, who has mouth odor, do well to tell the person to listen to the show, or you can actually listen and then tell the person what you've learned and how to get treatment for bad breath. All right, when you hear bad breath, it simply means a disease caused by poor oral hygiene. Poor oral hygiene, that you don't take care of your oral health. You know, when you say that you're healthy, when you talk about health, you're basically talking about a whole lot of things: physical health, social health, mental health, all of that, okay, inclusive. So oral health is also part of the health we're talking about, and that is why we're bringing you this show. When you hear bad breath, mouth odor, it is as a result of poor oral hygiene, but it is not always the case. Poor oral hygiene is not always the case. It can also occur due to a number of health conditions, including dry mouth, heartburn, or even diseases in another part of your body. Just like when you have headache, it is not just about the headache, it's about the underlying cause of that headache, something that is causing that headache. Okay, so bad breath could be a symptom of an underlying problem, health problem. So we'll talk about all this today. So first of all, let us look into what bad breath or mouth odor is. Bad breath or mouth odor is a medical term for halitosis. Okay, everyone gets bad breath from time to time, especially after eating a particular kind of food, like when someone eats garlic, onion, or some other strong food. When they speak, you want to run away, you know, because of the odor that comes out from this person's mouth. But it actually goes away after some time. It actually goes away, just like garlic breath and onion breath. It goes away after a particular time. But bad breath or mouth odor, as we all know it to be, is continues even after the number of after the garlic breath it's supposed to have gone away. You're still perceiving that strong mouth odor from the person. This is a chronic halitosis, a chronic bad breath, a chronic mouth odor. So it could mean you have an oral health issue or another condition affecting another part of your body. Then it is coming out from your mouth. So, you know, the body is just like a machine. They all work hand in hand. If you're having headache, it could be that your blood pressure is high. It could be a symptom of another thing. Like some people, when they are dehydrated, when they don't take enough water, they will start having headache. So it could be that. It could be anything. So the body is just like a machine that work hand in hand with all other parts to ensure optimum performance. Okay. Now, halitosis is a symptom of many different conditions. It's like a warning message from your body, a sign that something is wrong with this side, something is wrong with the other side. Finding the root cause of halitosis or your bad breath or your mouth cause is the first step in treating that underlying medical condition. Now, now that we have known what bad breath is, let us look at how common it is. It is very common. It is very widespread. In fact, there's a study that says it is 1 out of every 4 persons around the world that has bad breath or mouth odor. A lot of people have it, but they do not know that they have it. And because they don't know, they are reluctant about seeking help. They don't even know that they have a problem, so they should seek help. But when we are talking about bad breath, let me make this clear. When you wake up from sleep, if you did not brush the previous night and you wake up from sleep, obviously you're going to have bad breath. Your mouth is going to smell when you wake up from sleep. But after brushing your mouth, it should go away. After eating, it should go away. But after brushing your mouth and eating and this smell continues, then there is a problem. You have halitosis or you have bad breath or mouth odor. Now, let's go to the symptoms. The main symptom of bad breath is foul smelling breath or strong smell oozing out from someone's mouth, which doesn't go away on its own, which doesn't have a time limit. It goes away, like you're saying, okay, in the next 10 minutes it's going to go away, in the next 30 minutes it will go away. No, the odor may be very strong that people begin to notice. When you come close to people, they will turn their faces just because they don't want that smell coming from your mouth. They don't want to stay very close to you. They always avoid having conversations with you. Even when you're saying the wrong thing, they don't want to engage you in an argument because they know that engaging you in an argument is a whole lot for them. It means that they have to stay with you and keep receiving that strong breath coming out from your mouth. Now, the most common cause of halitosis is poor oral hygiene, inability for you to brush your teeth very well. Some people just brush once in a day, but normally you are supposed to brush twice a day, morning and night. And if you're someone who brushes at night, you will notice that whenever you brush at night, if you wake up with this fresh breath. Your mouth doesn't smell like when you don't brush it and go to bed. Okay, your mouth is still fresh. So inability for you to brush well and brush often as you are supposed to will actually cause you to have bad breath. Some people, they don't even take time brushing their teeth. Within 1 minute, they are done brushing their teeth. They don't see brushing teeth as that, they don't see it like bathing where they need to take their time to wash their armpits, wash other areas. They see it as, let me just do and go. Let me just do and go. It's not dirty. But it is. You don't need to brush your teeth in such a way that you say, let me brush and go. No. Take your time. Use 3 minutes to 5 minutes in brushing your teeth. Brush your teeth, brush your tongue very well, clean your tongue very well, then clean up the roof of your mouth. And doing that, you have to use a soft brush so you don't injure any part of your mouth. Now, some people don't floss. They don't know how to floss very well. And if you leave particles of food in your mouth, definitely harmful bacteria will invade your mouth and multiply out of control, and that will lead to several oral health issues like halitosis, cavities, and gum disease, and the likes. So you do well to know how to floss, know how to brush properly, and brush regularly. Twice a day is not too much. Some people will say, Nigeria is difficult, I don't want to waste my pace. It is not wasting your pace. It is you taking care of your health, because I know you don't want a situation whereby you sit closer to someone and you want to speak, the person turns his face or the person stands up because of the breath coming out from your mouth. That will be a total turn off, and it will also be embarrassing for you. Now, let us look at some other causes of halitosis or bad breath or mouth odor. While we have said that poor oral hygiene is the most common cause of halitosis or mouth odor or bad breath, it is not the only cause of it. There are several other conditions that might cause bad breath, and these include dry mouth. Dry mouth, saliva helps to wash your mouth. Saliva helps to keep your mouth wet and wash your mouth. So if your body isn't making enough saliva, if you have dry mouth, it can lead to halitosis or mouth odor or bad breath. Smoking can also cause dry mouth. You see people who smoke a lot, they usually have dry mouth. But when they speak, you will know that the breath coming out from their mouth shows that this one has halitosis or bad breath. It seems he has dry mouth. And it also increases your risk for gum diseases. Dry mouth increases your risk for gum diseases. So there are certain medications that can also cause dry mouth. So if you're taking any medication, make sure you ask your physician or your doctor to tell you the side effect of the medications you're taking, so that you look out for dry mouth. If it is a medication that is causing your dry mouth, already you will know that okay, it is because I'm taking this medication. Once I'm done taking the medications, I will be fine. Okay, so just know that basically dry mouth causes halitosis or bad breath. Then we have head and neck cancer. Head and neck cancer is another symptom of oral cancer or throat cancer. All right, so symptoms of oral cancer or throat cancer includes bad breath. If you're having throat cancer, you will have this strong odor oozing out from your mouth. If you're having oral cancer, you will still have this bad breath coming out from your mouth. When you speak, people tend to say, oh, this one has mouth odor. And sores, oral cancer sores. I talked about ulcer, mouth ulcer last week Saturday. And I talked about precancerous and cancerous mouth ulcers. If you missed that program, do well to check our YouTube channel on Voice of the People 90.3 FM on YouTube, and go to the playlist Health Talk with Bibi. Then you will see it. Some of the mouth ulcers are cancerous mouth ulcers. If it is cancerous mouth ulcers, it leaves you with sores that don't go away. They don't heal on its own, unlike your canker sores. All right, and they are painless. All right, they are painless. But the only thing is that you have difficulty swallowing, you have difficulty breathing sometimes. So when you notice that you have mouth ulcers or sores that don't heal on its own, that it's up to 1 month and you're still seeing these sores in your mouth, it's up to 2 months, you still have it, you need to see your doctor, because in all diseases, early detection is key. When you see your doctor, it is your doctor that will rule out that, okay, it is an oral cancer, it is not an oral cancer, and you'll be placed on medications to help you out. So just know that oral or throat cancer can actually cause bad breath. Now we have another one, gastroesophageal reflux disease. Gastroesophageal reflux disease. That's what we all call GERD or GERD, as the case may be. It is a digestive disorder in which stomach acid or fluid leaks back into your esophagus. That's the tube that takes food from your mouth to your stomach. Like, it usually happens to people who have digestive issues. Okay, there's one, I've forgotten what they call it, but when I remember, I'll actually tell you. So they usually have digestive issues, and when this stomach or acid fluid leaks into your esophagus, like it goes back, it's not supposed to go back into your esophagus because it is what helps your food digest. But when the stomach acid or fluid leaks back into your esophagus, all right, it leads to bad breath. Like, you can actually feel the smell. You can actually feel the smell of the food that you just ate, or the food you after hours of eating that food, you still feel that you're perceiving the smell of that food from your mouth. They call it okay, I think when I remember I'll just tell you, all right, but I know it has to, okay, intestinal obstruction. For people who have intestinal obstruction too, they get to have bad breath, okay, because their digestive system already has an issue. All right, it already has an issue, and that stomach acid or fluid will now leaks back into the esophagus, making them to have that bad breath. When they speak, it seems that they are perceiving that poo smell, that fizzy smell in their mouth. All right, so that is for gastroesophageal reflux disease. Then we have another one, tonsil stones. Tonsil is located in the back of your throat, So when food gets stuck in your tonsil, it sometimes hardens into calcium deposits called tonsil stones or tonsillolitis. So when this happens, also expect bad breath or mouth odor. But in all of these that I'm telling you, you cannot tell which is your problem if you've not seen a doctor. So bad breath can be a sign of an underlying health problem. I told you earlier, it could be a sign of an underlying health problem that you have a problem. So it is a doctor that will rule out if it is coming from a poor oral hygiene or from an underlying health condition. Then we have gum disease. Gum disease is an inflammation of your gums that causes redness, swelling, and bleeding around your gums. So it is caused by plaque. You know what we call plaque? When some people show you their teeth, these sticky, milk-like things on the teeth. Okay, if you have that milky-like sticky things on the teeth, some people use knife to remove it. Some people, they will go to a dentist. The dentist has to use their equipment to remove it. So if you have plaque is usually gum disease is usually caused by this plaque. Okay, it's a sticky film. It builds up on your teeth, but brushing alone cannot remove plaque, except some people use knife, but that's not good. Some people try flossing, and some people go to the dentist to help them to remove it. Then you also know that untreated gingivitis can lead to bad breath. Okay, this thing damages your gum tissue and can lead to tooth and bone loss around your teeth. So you do well to check with your doctor which is causing your bad breath so that you get help. Then when you have infections in your nose, when you have infections in your throat or lungs, for example, people with pneumonia, sometimes they cough so hard that they cough up liquid that smells bad. So when they cough out that liquid that smells bad, it can actually give them bad breath. Like when you cough it out, you smell your mouth, you are perceiving that smell, that bad smell, and it can cause bad breath. So when you notice this is your problem, you get help and treat yourself. Then people with diabetes is also an issue. People with diabetes have an increased risk of gum disease, and gum disease can make it harder for you to manage diabetes. Okay, so diabetes is also could be an underlying health issue that might lead to your bad breath due to gum diseases. Then we have liver diseases or kidney disease. When your liver and kidneys are working properly, you already know the work of the function of the kidney and the liver. That is to remove toxins from your system, from your body. But in a situation whereby your liver and kidney are not working properly, they are not removing these toxic substances from your body, the result can lead to bad breath because you still have toxins in your body, and the only way you can ooze them out is from your mouth. When you want to speak, it comes out. People can actually smell it. So it can be a sign. That's why I told you earlier that it is not only poor oral hygiene that can cause mouth odor or bad breath. At times, it could be an underlying health issues like you can be having bad breath. You won't know that your liver and kidneys are not working properly. Sometimes it doesn't pose any sign. Sometimes it shows you little sign that you can just ignore and keep living and keep doing your daily activities, and it keeps getting bad. So if you notice you have bad breath, always check with your doctor to rule out any issue you have, any underlying health issue that might be causing your bad breath. Then we have another one we call Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease that can lead to muscle pain, dry eyes, dry skin, and dry mouth. And you know, dry mouth is also linked to bad breath. So when you have dry mouth, you know that it's likely you develop bad breath or mouth odor. Now, what does it mean if you have bad breath all the time? Well, if you have chronic bad breath or chronic halitosis, it could mean that you have gum disease, but it's not always the case though. It can also, like we said earlier, that it can also be a sign that you have an underlying untreated medical condition, an underlying medical condition that has not been treated, that you are not taking care of. So anything that happens to you, check if actually it is that thing or it is an underlying medical condition. If it's an underlying medical condition, the only person that can rule this out is your doctor. And I know that in Nigeria, we don't have that culture of checking up with our doctor. We don't have that culture of going to the hospital to go and check ourselves up. Someone will tell you, I've not eaten food, and you're telling me to go to the hospital. But then it is a good thing, because when the doctor says you're fine, you are relaxed. But when you go to the hospital and they tell you that something is wrong with you, and thank God you even came. Have you had that situation of a doctor telling you, thank God you were right here on time? Assuming you wasted time, it would have been worse. So such situation, to avoid it, the best thing is to go to the hospital to check yourself. If you know that maybe you're having bad breath, check with your dentist. Your dentist will tell you, okay, I'm not sure it is as a result of your oral hygiene. Maybe you need to go and see your doctor, and the doctor will rule out any condition that you might feel you have. Then if you had bad breath that doesn't go away, you know what to do. Okay, and if you know that you have a good oral hygiene, you brush morning and night, and you brush well. When I mean brush well, you take your time to brush. Then that means there is another underlying problem that is causing your bad breath. Now, how do you know? Some people might say, how do I know if my breath stinks? How do I know if I have mouth odor? Because like when we talked about body odor, some people are not aware that they have body odor. Similarly, some people are not aware they have mouth odor or that their breath stinks. So if you have a bad taste in your mouth, you can actually, it's a sign to tell you that you have mouth odor, that you know that your mouth is tasting bad, not that you have malaria or you have any health issue. You're healthy, you're fine, but you have this bad taste in your mouth, is a sign to tell you that you have mouth odor. Okay, then you can actually use your hand to cover your mouth and perceive it. Just try to bring out try to exhale air from your mouth and perceive it, just like this. If you're watching live on YouTube, like you perceive it, then you will know that, you will know if you have mouth odor or not. Okay, then to be properly sure you have mouth odor or not, your dentist will tell you that, if you can check up with your dentist. Then talking about treatment of halitosis or treatment of bad breath or treatment of mouth odor, it depends on the root cause of the issue. If it is poor oral hygiene, then you know that you need to do better when it comes to oral hygiene. You need to brush well. You need to brush well. Take your time to brush, and also brush twice daily. Okay, brush after eating your breakfast in the morning, and that is for people who brushed the previous night. You know, if you brush the previous night, you can actually eat your breakfast without brushing. But some people, because they did not brush the previous night, when they open their mouth, it smells and they can't eat their breakfast. All right, so make sure you brush twice daily, morning and night. Then if you've ruled out, okay, someone is calling me. I didn't open the phone line, but let me just take the call and see what we have here. Hello, good morning to you.
Hello, good morning.
Good morning to you. How are you doing?
I'm good, I'm fine.
All right, let's get to meet you.
This is Mr. Yeah, this is Mr. Easy.
All right, Mr. Easy, good to have you here. We're talking about
this your topic today is really interesting one.
Thank you.
Do you know, will I say is not a fair one from my end, because I was with someone that has a mouth odor, and that made me, I didn't talk to that person again. I just lost contact with that person because the mouth odor was so chronic. Like, I was like, what kind of odor is this? So is it that I think that thing is from the stomach?
Yes.
Some persons, they have the...
Yes, that's where I talked about gastroesophageal reflux disease, the stomach acid leaking back into the esophagus, then it comes out through your mouth when they open their mouths.
Yes. Yeah,
but
yeah. So it's like they need to treat that stuff. That thing, they
did you tell the person he has mouth odor?
Are you hearing me?
Did you tell the person he has mouth odor? Did you tell the person?
No, that's why I say it's like it's not a good one from my end, because the thing just make me, I look at it like it's an embarrassment. So I just like, I just distance myself. But I don't know.
All right, next time just find a polite way to tell them, because at times they don't know they have bad mouth odor.
Okay. And again, I believe as a lady, they should be more conscious than men. Men should be
more conscious. Everybody should be conscious. I think everybody should be conscious, because even if I meet a guy that has bad breath or mouth odor, I wouldn't stay.
Okay. No, what happened? Thanks for this.
Thank you,
and also,
Mr.
yeah, thanks.
Thank you so much.
All right.
Okay, talking about this thing, if you notice someone has bad breath or mouth odor, the good thing you can do is to politely tell the person, because they don't know, just like I said earlier, and just like I talked about body odor the other time. Usually they don't know they have body odor, they don't know they have mouth odor, but you finding a polite way to tell the person that, see you, I think your mouth smells so bad and all of that. And you know that people can actually lose opportunities because of that. Imagine you coming for an interview and you open your mouth to answer the interview question and something is smelling, your mouth is smelling. They will just tell you, don't worry, go, we'll get back to you. And that will be the end of that job for you. So you can do an honest review by asking people around you, your very close friends, if they notice you have bad breath. By asking questions, you get that awareness, or you get that you get the information either that you have it or you don't have it. And if you do have it, do well to get treatment. Please don't choke people with that, okay? Because it can actually be choking, and people wouldn't want to engage you in a conversation. All right, I think we're rounding up because the time is running so fast. So for treatment of halitosis or bad breath or mouth odor, do well to brush well. Take your time to brush well so that you can rule out poor oral hygiene as a cause of it. Then when you have ruled out poor oral hygiene, you will know that it is an underlying health issue like we discussed. So if you've missed this program from the beginning to the end, go to our YouTube channel on Voice of the People 90.3 FM. Go to the playlist Health Talk with BB and check some other beautiful topics that we have treated so you can be aware and informed. On this note, I want to inform you that this is not all we have on Voice of the People 90.3 FM. We have beautiful programs lined up for today. And please, my phone is ringing, but if you do have questions and I cannot answer it because my time is up, send your questions on our WhatsApp line on 0700 903 9039. WhatsApp line on 0700 903 9039. Send your questions there and I will answer you. Okay. On that note, I will say do have a beautiful morning, but I will still come your way at 11 a.m. to discuss Business Roundtable with Peter and Osike. Bye for now.